Hello, everybody, and welcome back to another episode of CCA's Medical Minute, sponsored by Kroger Health. I'm really happy to be here today with Dr. Andrew Gillihan, and so there's a particular reason why I wanted to get this topic out there. November is Men's Health Month. Sometimes you'll see it referred to as Movember. Apparently, Dr. Gillihan and I are already doing the no-shave thing, yes. So we already got that piece covered. But September is Prostate Cancer Awareness Month, and you got Breast Cancer Awareness Month in October. But I guess the guys kind of take one here by claiming November now as well for Men's Health Month. But I wanted to talk to Dr. Gillihan today because he is, and I'll let him describe his own business, but he's doing something that's now near and dear to my heart as a result of my 10-year metastatic prostate cancer journey. And I'm now dealing with some things, the after effects of some of the treatments that I've had and things like that. And so what we'll probably focus on today is the issue of the always fun thing to talk about, urinary incontinence. But we'll start by, Dr. Gillihan, can you just tell us a little bit about your practice, what caused you to get into doing what you do, kind of what all conditions you guys work with in physical therapy, and I know a good deal of that is men's pelvic floor, but if you could just kind of explain your business, it's called Alinea Performance.
Alinea Performance, yep.
Okay.
Yeah, so my role, so I have a doctorate of physical therapy. So by trade, I am a physical therapist. Our practice largely deals with sports, orthopedics, and then I specialize in male pelvic health. So really what that incorporates is we see a lot of men post-prostatectomy, post-radiation, post-bladder cancer, colon cancer, any sort of abdominal surgeries, low back pain. We see men across the gambit with any sort of pain, incontinence, whether that be urinary or fecal. Our role at the end of the day, post-radical prostatectomy, is to help men come back and improve quality of life from a component of urinary incontinence. That is largely from a side effect standpoint, and as Steve mentioned, was a component of the removal of the prostate. You actually remove one of the sphincters that actually helps you keep urine in your bladder. Our job is to help you functionally facilitate the other muscles around the pelvic floor to improve the quality of life, to maintain continence. Really, that looks like a Kegel is naturally what people think about. But our job as physical therapists, and our job as performance physical therapists, us being in more sports and orthopedics, is to help you apply that Kegel to a component of life in general. Many times, I think we perform them incorrectly. Men perform them in silos, following their treatments. That's usually what they're given, is a piece of paper. Yep. And as you can probably attest to, it's a very simple, hey, go do Kegels, do it 10 times a day for 10 repetitions and hold it for 10 seconds. And that doesn't apply to real life. Real life doesn't happen in bouts of 10 seconds at a maximal contraction. Yeah. We are up, we are down, we are moving around, we're picking things up, we're hiking, we're running, we're jumping. And that contraction in the pelvic floor has to be applied appropriately as well. So our job is to help men really regain that function, regain that motor programming, that motor learning side of things, to help improve the quality of life and decrease incontinence overall. Yeah,
you and I talked about this actually on the phone a couple weeks ago. But this is an observation, my own observation, and I'm entitled to this because I am a man. But I think for the most part, kind of what you guys do. Well, I'll get to the importance of how I think this fits in. But I think that men, at the very beginning. So let's just take prostate cancer as an example. Without proper awareness about that, oftentimes it's only getting diagnosed in response to symptoms. Mm-hmm. Probably even in that setting, too often it's probably too far. They've let it go a lot further than they should have, just due to the reluctance to go to the doctor and do those kinds of things. So you're already kind of battling that. But I think men are more prone to just deal with things acutely. Like, so, okay, I've got prostate cancer, get it out of there, cut it out. Okay, now I'm, down the road, I got a little bit of incontinence after that. What I'll do, I'll wear a pad. Maybe I'll do these Kegel exercises, and it gets better. Okay, well, now I can forget about it. Then later, maybe problems come home to roost. But there's nothing, nobody tells you about anything you can do in between to where maybe those problems that come down the road later don't come. I mean, or maybe it just becomes such a part of your routine that it never really manifests in a way that it affects your lifestyle. And so that's where I think this is really key, is that, if you get to the point where if you're not really doing something in between, the urinate, the leakage and things like that can become profound. And now if all of a sudden you've got to really start to take into account where you're at, where you're going, what time you come home at night. I mean, just because you start to have these real kind of lifestyle things. So can you give me an example of, I know you kind of talked about a couple of things, but what does a program look like for a guy that is now dealing with urinary incontinence, kind of post-prostatectomy, maybe post-radiation, that kind of thing? What's the duration of that look like? I mean, what is it, a 2-month process, 3-month process, 6-month? How does that, practically speaking, what would a guy expect?
Yeah, and like you said, we chatted about a little bit about this beforehand, from a component of research, right? So this isn't necessarily coming from me. These aren't concepts that I've made up. They're not things that I've actually researched. It's coming from a larger body of people that are doing really good work. So Joanne Milios, she is in Australia, so she's kind of leading the forefront on men's pelvic health. Australia seems to be significantly better at men's pelvic health than we are in the U.S. in general. But overall, we're looking at, from a research perspective, honestly, we want to get guys in for pelvic floor PT prior to those procedures anyway. So typically, based on the evidence that she has, is more so we're looking at, we want to get somewhere around 5 weeks prior to the procedure itself. So upon diagnosis of prostate cancer and having that date set for radical prostatectomy or the procedures for radiation or anything else, we want to get guys moving forward from a component of, we can actually teach them the components of the Kegel to better understand prior to that prostate being removed. So you can imagine, just like any other surgery, or just like walking, I use as an example for guys that come into the clinic. If I were to teach you how to walk after you not knowing how to walk ever, and then all of a sudden something happens and we got to reteach you, well, that's significantly more difficult than you understanding how to walk prior to an injury and then trying to relearn how to walk.
Okay.
So it will take much longer for your brain to actually understand how to learn how to walk for the first time.
Okay.
Much as you think of a baby, right? Or a child, somebody that's actually growing and aging. Initially, when they learn how to walk, it takes months and months and months.
Yeah.
So now if you think of an adult that never learned how to walk, that's a different conversation of trying to teach them how to walk later in life.
Okay.
So from a component of Kegeling and understanding a functional perspective, we want to try to get guys to understand this is how you Kegel prior to removing the prostate. Following that, it typically takes about 12-ish weeks or so. So really, you're looking at about 5 visits prior to the procedure and then about 12 visits after. And we typically only see men about once a week.
Okay.
And that's largely to maintain objective measurements and how do we say, how continent are you at the end of the day? So from a component of what we actually do, we're applying that concept of a Kegel that most men know of, like, hey, just squeeze your pelvic floor, close off your urethra like you're trying to stop your flow of urine. While that's helpful, it doesn't apply those features of the real world. So in our clinic, we're actually using different weight machines. We're doing jumping. We're doing plyometrics. We're doing versions of pushing a sled to simulate mowing the lawn.
So you'd be like Rocky?
Correct.
Okay.
Exactly.
Right.
So, anything that you can imagine that you may want to do in real life, whether that be hiking, whether that be climbing something, we're actually going to apply that inside of our office. So all of our offices are actually in gyms as well.
Okay.
So we have all this equipment that we can actually simulate what you need to go do, and then we can say, okay, you're either able to functionally do this and maintain continence, or you're not.
Okay.
And if you're not, well, let's find a way that you can.
Yeah.
And then we'll gradually grade you back into the things that you want to do.
Okay. So, and because, like I said, we could probably talk, and we may end up doing multiple episodes on this, but like, I know one of the things too, so it's like, the first piece of bad news, you got prostate cancer. So you got to deal with that. And then the second thing that happens is, in a case like this, now you've got these side effects, urinary leakage and things like that. That's bad news. Then there's more bad news, which is, what can you do to help mitigate that? Oh, don't drink no caffeine, no spicy foods, no. What are some of those things? Because to me, it's like, when I think about cutting out spicy foods, alcohol, and caffeine, it's like, wow, that's the third really bad thing. But what are some of the things, just lifestyle-wise, intake, consumption, that you can do to help mitigate, maybe not solve the problem, but help mitigate?
Yeah, and from a behavioral perspective, while those are good concepts to have, hydration is the number one component. What we see with men with urinary incontinence is going to be they're actually underhydrating. So what we look at from a baseline perspective, we'd like to have men intake half of their body weight in ounces. So say you weigh 150 pounds, we want to have you intake 75 ounces of water a day. That's from a baseline hydration perspective. Why that is many men think that if I intake less water, then I won't have to pee as much, right? And I won't urinate and I won't have as much incontinence. Unfortunately, that's a incorrect way of thinking about those types of things, because when you are dehydrated, that uric acid, so that yellow, really smelly part of urine, is actually affecting your bladder negatively.
Okay.
So it irritates your bladder. Just like those spicy foods, just like the alcohol, just like the caffeine, all those things, that uric acid is actually causing your bladder to send signals to your brain to say, we got to get this stuff out.
Okay.
So it's actually causing you further problems. So that's why normalizing hydration is the first thing. Along with that is, the spicy foods and caffeine and alcohol. Really sugary drinks are going to be a component of that. And that's partly to do with the renal system and things that go into that. But maintaining electrolytes is going to be a key component of, water follows sodium. So sodium, if it's in your body, you're going to maintain more of that water and it's not going to go through your kidneys and go into the bladder.
Okay. So
those components of that are significantly more helpful from just a baseline lifestyle behavior.
Okay.
I'll caveat that with our job is to not take things away from you to a component where you can't enjoy life.
Okay.
So if you have spicy foods, great, and you love that and you truly enjoy it, then you should enjoy those.
Yeah.
But you have to take into account those are going to affect you in some capacity.
Yeah.
That's really where we functionally come into play and say, if you want to have a beer at the end of the night, go ahead. You can't go crazy with it, right? And say, I'm going to have 6, because that's really going to blow you up at the end of the day. But our job is to not necessarily take everything away from you. It's to educate you and help you understand how are your behaviors and your habits affecting you down the road.
So from a selfish perspective, I'll ask this question: in that context, is alcohol? I mean, if I drink wine, is that going to be less irritating than beer because has some carbonation to it? Is there anything there?
Yeah, there is some evidence from a carbonation perspective that is irritating to the bladder. Alcohol is alcohol at the end of the day.
Yeah.
It's really based on percentage, right, and the amount that you're intaking.
Okay.
Your body doesn't distinguish whether it's wine or liquor or beer from that sense, and neither really does anybody else, right? It's just a component of, we just call them different things because they're made out of different things. So typically we say, hey, if you want to have a glass of wine, by all means, enjoy your glass of wine. Enjoy your time with your family. Enjoy your time, with people that you enjoy having time with. You should do that. That's not our job. It's just to help you understand, hey, there are implications to your behaviors that you have over time.
And are these conversations, are they kind of incorporated in the program as well? Okay.
Yeah. Every single guy that I have come through my office, this is the conversation that we have.
Okay.
At the end of the day, there's a lot of education that goes into post-prostate cancer, just treatment in general. So our job is to help facilitate that for you over quality of life over the lifespan. So, because really that's going to follow you, right? You don't just magically one day have a prostate again,
right?
And from a component of, what can we really help with? There's a lot of those things that we can educate on and provide and do functionally, but we also talked about it before of what can we really not affect, right? Is from a neurogenic bladder standpoint of, if you have a guy that has radiation that he doesn't know if his bladder is filling up, that's something that we can't necessarily affect, right? That's a sensory thing that's going on. The nervous system, we don't have enough tools in physical therapy from a very conservative standpoint to help with that.
Okay.
So there are many times that we've had men come into the clinic and, well, can you actually feel your bladder filling up? Do you feel that sensation of, oh, my bladder is full?
Yeah.
And if they don't, and they're just continually leaking, that is something, there are other methods that you're going to go see your urologist. You're going to talk to your oncologist of what happened during radiation. Was there something else that got radiated that wasn't supposed to, right? Or somewhere along those lines, if there are adverse effects to some of the treatments we have.
Gotcha. So. I sometimes jokingly say, because I'm 10 years in, multiple treatments, and so between surgery and radiation, everything, like I've been kind of mutilated, medicated, and irradiated. Are those things cumulative? So say, for example, if a guy goes in, prostate cancer, a radical prostatectomy, he's considered cured. Is he going to be less likely to have these urinary incontinence than a guy that's got a cumulative effect of, I've had that, and I've had radiation, and I've had, do they stack on top of one another, or?
They can. That's not a 100% though, right?
Okay.
From a component of, there are a lot of things from adverse reactions and adverse events that happen within those treatments, and there's obviously those things that they're supposed to tell you before you go get them of like, hey, this could happen, right? From a component of, do they stack though? It's really dependent and it's case to case.
Okay.
So I've had men come in that have had radical prostatectomy and they've had radiation, they've had hormone, all of those things, and they still have full sensation.
Okay. Just
a matter of, one, do they have the education? But two, do they have an understanding of their body in general?
Okay.
How long is it going to take to regain that function of, it could be 5 years down the road.
Yeah.
And we're 5 years, post-op of prostatectomy and a couple other treatments. Well, not to say that it makes my job harder, but you're set back a little bit further.
Okay.
Those processes and those behaviors and neurologically in the brain has really accumulated over time. So if we're talking, if we're James Clear, Atomic Habits, those things that you are doing over time, they solidify and they get cemented even further into your personality, your behavior, and your lifestyle. So trying to reverse those or change them really becomes a little bit more difficult. And it may be a little bit more of a shocker when it's like, hey, you need to stop doing certain things, or we need to incorporate certain behaviors to help you move forward faster.
Gotcha. And so what's so important about this, and we'll start to kind of wind down, at least for this episode, but and you and I talked about this, is that everything we've talked about today, those conversations typically do not happen in a consultation about cancer, about prostate cancer. There's just no time. Appointments are relatively short. And like I said, you're dealing with the acute issue at the time. So I really think this is a really, really vital service. Do you guys, your practice, is there any insurance coverage for that? Is it all kind of out of pocket, or how does that work?
Yeah, so it is a combination of both. So obviously there are cash services for it, and it really just depends on the insurance plan, right?
Gotcha.
We talked about it earlier of, sometimes the insurance company is the barrier to entry for those things of what will they cover. But we have options to work together with men across the country even. So it doesn't exclusively have to be in person, albeit there are many pieces to that are much more helpful to have these conversations in person, right? Sometimes they're more impactful in that sense. So yes, the practice works with insurance and more of the cash-based services in whatever capacity we need to. We're gonna help as many men as we can.
Can I guess maybe as part of initial consultation or a phone call, can someone call and say, "Hey, here's what kind of coverage I have," and then get some kind of gauge as to what they might be looking at?
Yep, absolutely. Okay. So we do anywhere from 15 to 30 minute the free consultation. Okay. I'll sit down and I'll have a conversation with you on the phone and say, hey, can I actually help you?
Yeah.
Right. That's going to be the biggest question is, as a provider, it's one of those things where we want to get you to the place where you need to be. So if I think I can help you, then I'm going to tell you I can help you.
Yeah.
And then we're going to talk about ways that we can work together. Okay. So, yeah.
We know a thing or two about free consultations here at Cincinnati Cancer Advisor. Andrew, how can people get in touch with you?
So our clinic is in Silverton, Ohio, so in the Cincinnati area. So if you're near Kenwood, Silverton, it's a small little place. My office is inside of a gym, so it's inside of the gym called Power 3 Fitness. Phone number wise, you can reach out that way, 513-434-3669. You can shoot us an email. It's infocincy@alineaperformance.com, or you can find us on social media. So all over the place, Instagram, LinkedIn, Facebook, all the stuff.
Gotcha. Okay. Well, thanks for coming out today. A really, really important topic, because as you and I talked about before, I think guys are kind of reluctant to seek treatment sometimes, and sometimes it's just even hard to just even sit down and say, "Hey, I've got this problem." Yeah. I mean, because it can be embarrassing.
Absolutely.
Things like that. So I think it's really important to get this dialogue open. So really appreciate you coming out today, and we'll do more of this over time. And you and I talked about this before, but Dr. Barney, who you're now in practice with, one thing I'm going to want to touch on in the future is how this can disproportionately affect African American men.
Absolutely.
And what possibilities are there for treatment for them as well. So.
Yep, absolutely.
Okay.
More than happy to do that.
All right. Thank you so much, Dr. Gillihan.
Thank you.
Thanks to everybody for tuning in today, and we'll be back again soon for another episode of CCA's Medical Minute. Thank you.